Now, I'd like to welcome our next presenter, Sir Iyer Sir, Iyer Sir. He is a distinguished professor at Dean and Ray University, Ahmedabad, holding a PhD in computer science with extensive industry and academic experience. Sir, I'd like to request you for your speech.
Yeah, thank you very much. A very good afternoon to all distinguished audience, and a special thanks to Dr. Iman and the entire organizers for allowing me to be a part of this esteemed conference. I would just like to apologize that I have an urgent meeting which was scheduled. I planned my schedule accordingly so that the meeting does not disrupt with my conference talk. But unfortunately, I was supposed to complete by 3:30 the conference talk, but unfortunately there was some kind of adjustment. So I may have to end in 5 or 7 minutes in particular. So I apologize to the organizers for that. I hope I'm able to do justice. I would just like to shorten my presentation today. Again, a warm welcome to all in the first conference, International Conference on Emerging Trends and Innovation. I would like to focus upon innovation trends in medical imaging. I'll just skip some contents. Yeah, as per the research credentials, actually, we are working on 17 UN Sustainable Development Goals, out of which the third goal, that is good health and well-being, is at the core of every particular research that is going on, especially in the healthcare sector. So with this goal in mind, we are focusing upon all that we can do to make this place disease-free and contribute towards detection, and treatment of various diseases. Latest advancements have been wearable devices and a lot of other supplementary patented devices which can help in predicting and preserving our healthcare sector. So I would like to talk about all these sustainable goals, but today I would like to focus more upon healthcare sector. So artificial intelligence, the earlier speaker, Dr. Nadeem, has talked about generative AI. I would like to focus upon AI in healthcare sector. So a lot of use cases are there where we can use AI for drug development, medical diagnosis, dosage error reduction, cancer research. I would like to spend 1 or 2 slides on cancer research also. Fraud detection, cyber security, virtual nursing assistance. That is something which has been a new concept which has been come into being in the last few years. AI robot assisted surgery, that's very prevalent right now in some of the Western countries. We are slowly bringing it into Asia, so I think so it would be soon a reality in India also, and Pakistan, maybe Bangladesh, all the Asian countries. So I expect that this would be the game changer going ahead. Now, this is what is the advancement I was talking about. Like I have not tried to include, because of 5 to 7 minutes, I have not tried to include my research work over here, but I'll try to focus upon some general concepts so that I can complete it on time. The wearable brain scanner is a very good change to what was earlier available. Like I've just quoted on the right side, MEG scanners were there. Now MEG scanners are very, they occupy a lot of weight. They weigh up to 450 kg. And during that, when the patient is being, the test is being taken, then due to the brain's magnetic field, the patient must stay still and patient cannot move from here and there. So it's very difficult for small children or elderly people to feel comfortable there, especially for small children. Now, an alternative is a portable MEG device which actually focuses like the same. But the only difference here is that the weight of this is less than 1 kg and patient can move around inside specially designed room that counters the influence of the Earth's natural magnetic field. So if you just see here, this is where technology is advancing and this is how we can contribute towards more innovative devices in medical imaging and healthcare, which can actually focus upon a lot of betterment for the patient. The only concern here is the cost. Cost reduction is something which we have to work on. Otherwise, we have been able to reduce the weight, we have been able to make it more friendly towards the patient, but probably we can work on the cost front also. There's an ultrasonic device to capture blood pressure levels. Again, this is very much prevalent right now. You don't have to go to the doctor to monitor your blood pressure levels. Then there is a smart contact lens for detecting glucose. These are some of the advancements which can change the entire way how we are dealing with our lifestyle related diseases like sugar, etc. Now, if you want to scan, now this is again a very new concept which is prevalent since the last 2 years. I would like to say post COVID, ingestible pill sensor system, wherein we can take the entire scan of the abdomen and the stomach based on a small pill that we can directly ingest. This is smart pill, and it will give all the information, all the images on the mobile. So this is something which, and it is not harmful to the body also. So this is a huge advantage as far as our healthcare sector is concerned. And the earlier system where we were injecting some tube, etc., into our body to get the scanned images, that would not be required now. I was talking about cancer detection. Now, there was an experiment which was done wherein a 15-year-old experienced, a person with MD with 15-year-old radiology experience was asked to mark on the screen on the particular the shapes, murky shapes, uh, where the cancer-related prostate creeping cancer was involved. So that he had marked with the help of his experience. On the other hand, other side of the screen, artificial intelligence computer program has done the same, and the results are, as you can see, it's almost identical. So when we say that we are transforming healthcare sector with the help of technology, I think so. This is the best example of that. And in radiology, that is medical imaging, if we are bringing about this change, that is very much required. So we can also use some tests, and doctors normally use these tests. Now, same way AI can also predict what is the cancer like, what is it a harmless lump or is it a cancer, how fast it is growing, what can be the speed, accuracy, and reliability with which doctors are answering. Somewhere we can say that AI is replacing doctors in that or supplementing doctors in that. So this can be very useful in remote areas where doctors are not available there or specialists are not available. That AI can play a very important role in providing this kind of services. Now, I'll just like to skip this. Yeah. Two more areas where a lot of changes are coming in is glaucoma and diabetic retinopathy. These are all relevant diseases which have come due to lifestyle related changes due to maybe hereditary and various other factors. So glaucoma is actually the WHO surveys that there will be 95 million glaucoma patients by 2030. So 93% of those are going undiagnosed at the earlier stage, which is required for a reversal of that or at least stopping the increase of the glaucoma. So for that, actually, again, we can use AI, we can use medical imaging to very good effect. So again, glaucoma and diabetic retinopathy are some areas. Actually, I would like to give a small example here how a healthcare sector is being transformed in India. Madurai is a small city in which there is a small place in Madurai where a eye hospital, Arvind Eye Hospital, is located. Now, this Arvind Eye Hospital is run by a doctor who is having a very good experience of treating cataract and glaucoma related diseases, and he has made the maximum number of surgeries in a day for cataract for elderly patients. So, with his experience, Google's healthcare arm has tied up in 2018 with Arvind Eye Hospital to provide an algorithm which can be predicting the eye-related diseases as soon as from the first stage itself, and maybe in a little bit advance also. So this is something which I feel can change the entire scenario where big players can team up with small healthcare hospitals, and they can really focus upon changing the entire dimension of how healthcare is going about. So these are some advancements. I would skip this because of paucity of time, but I would like to come to one or two slides where I think this is very important. Post COVID, actually, this is very much important. Almost all of us are becoming health conscious. Earlier, I was not going for a walk pre-COVID, but after COVID, I have started going for regular walks. So I want to have a check on how many steps I have walked today. So for that, a lot of devices are there, a lot of wearable devices are there which can help you do that. How well do I sleep? Now, this is something which is very much revolutionary, where a lot of research is going on in this domain. So, any researchers who want to work on wearable devices for sleep prediction or sleep, how you're sleeping, they want to sleep detection, I would like to say, then they can do this. And this can be particularly useful for those people who are not getting regular sleep, who are getting disturbed sleep, and even for youngsters. So this can be monitored by doctors also. So suppose I have slept for 8 hours, but in that 8 hours, 2 or 3 hours, I feel that I'm disturbed. So I'm not able to measure what is the reason or why I'm getting disturbed, but maybe this wearable device can detect what are the exact timings of my disturbance and how I can go about in changing the entire way in which I'm maintaining my lifestyle. So there can be some kind of mechanism which can detect and predict this also. I want to know more about myself. So, I mean, this is what we are talking about. If we can use IoT and AI to help us in life logging, that is what we are doing, how much time we are spending, etc., on various other things, that can also be done. So, these are all the advancements I was talking about. One more flagship product called Mindwave is there in the market, which is actually allowing us to do some kind of thought controlled computing. We are able to detect what our thoughts are, and probably now there will be a change in how we are thinking also. So devices will start deciding, though it is a little bit dangerous, but yeah, this can be one of the changing sources of healthcare sector. So what are the challenges here when we talk about healthcare sector and overall machine learning and wearable devices? Is that one is the cost factor, one is communication, storage limitations, maybe some power consumption limitations, uh, deployment alternatives. I mean, again, the cost factor comes in there. So how cost effective you can make this device and how effective you can make this. And there are some regional constraints as far as healthcare is concerned, where there are some regulatory constraints also. So that would be the major constraints which are actually, or the challenges which are driving the machine learning for wearable devices. I think so. That's all from my side. I've just cut short my presentation so that I can be available for the meeting. Actually, meeting has already started.
Uh,
So I hope, yeah,
Professor, I really appreciate the opportunity to learn from your valuable knowledge. And really, thank you so much for sharing your time and expertise with us. Really, it's a clear and a big honor for us to be that you are with us in this prestigious event. Thank you so much. Really, thank you so much.
thank you, Dr. Inam, and regret for not being able to give more time. Actually, I would
No,
have
no.
loved to, but
No, no, no.
yeah,
It's a pleasure, and it's a
looking
pleasure
forward.
to have you here. I
Yeah,
hope that
looking.
in the upcoming events, I will also invite you, and we will do some
Sure, sure.
collaborations.
Looking forward for more collaborations, and I would like to invite all the audience also. I mean, all the scholars or academicians also, if they are interested in any project which we can do together. Definitely, I'm welcome for that.
Sure.
Thank you very much, and sorry again for the
No,
short.
no. Sorry from our side. Thank you so much. Thank you so much.
Okay.